All right. Up next, we have Amar Doctor, presented by Mamoon Rashid.
Good afternoon. I'm Mamoon Rashid, co-founder of MedAI, and our solution, Amar Doctor, aims to tackle healthcare access inequalities through inclusive AI. So half of world's population doesn't have access to essential healthcare services. We all know this, it's a big number. What we often forget are the victims behind this healthcare access inequality. I met Rabia and her father in the corridor of a public hospital in Dhaka who was suffering from stomachache, blood in his stool, and loss of weight for 2 years, but he still hasn't sought medical attention from a trained medical doctor due to accessibility problem. They are not alone. The number is 6 million in Bangladesh alone. In the era of AI and digitization, we should be able to solve this accessibility problem. But why aren't we able to solve this problem? In Bangladesh, there are 60 million smartphones, but the adoption of smart health technologies are quite low. And there are two primary barriers for this: poor digital literacy among patients, and then lack of interest from doctors. And Amar Doctor is here to solve that problem. So we have trained medical speech recognition, NLP, and a custom AI recommendation engine. And leveraging those engines, our AI health assistant guides the patient through a series of medical questionnaires in their preferred language in a voice interactive way to reduce the impact of poor digital literacy. And based on the collected symptoms, we then provide very inclusive recommendation to the doctor, which takes patient's ethnicity into account. And using this information, the doctor can then actually provide virtual consultation much faster. And we then complete the circle with personalized health education that is sent to the patient's smartphone immediately as soon as the consultation is done. So through 3 pilots in Bangladesh, we have reached to 10,000 patients so far. 200 doctors is using it, and we have completed 1,500 consultations through these 3 pilots. And one of the pilots we are really proud of is a Smart Health Champion project where we are training female workers from the RMJ industry to use Amar Doctor app to facilitate virtual medical consultations within their community. These Smart Health Champions, they didn't really have much education, much digital literacy, and they're using this app to do this. And supported by this amazing team who has been actually instrumental to build this solution, our vision is to actually facilitate 10 million consultations in Bangladesh within next 5 years and expand to 7 other ethno-linguistic groups so that we can serve these underserved communities across the globe. But this is a problem that we cannot solve alone. So we want to empower other digital health organizations and health organizations through our SaaS and API solutions to facilitate 20 million consultations within next 5 years. And we want to become the primary digital health gateway for Bengali speakers across the world. Thank you very much, and we'd like to hear from you how you can help us. Thank you.